Hi, I'm Dr. Joice Varghese MJ, Consultant Orthopedic Surgeon and Sports Injury Specialist, Lourdes Hospital, Cochin. So today we will talk about portals in shoulder arthroscopy. For a beginner who is coming into shoulder arthroscopy, putting the portals exactly where it needs to be done is very important. So knowing the portals is a basic thing for a beginning shoulder arthroscopy surgeon. So let's see how do we put the portals in the shoulder. So once the patient is positioned in the B chair position or whatever is your preference, you can mark the landmarks on the patient with the help of a marking pen. So you can identify the posterior aspect of the acromion, the angle of the acromion, the lateral border of the acromion, and the clavicle is also marked. And you can also mark the coracoid anteriorly. So what we need to do is to identify the first primary portal. The primary viewing portal is the posterior portal, and for that we need to identify the angle of acromion correctly. So my preference is you keep your thumb on the angle of the acromion and your index finger on the coracoid, and you can start the portal from a point slightly or around 1.5 cm below and medial to the angle of acromion. And the needle can be directed towards the coracoid, and you can get a giving away feel when you are entering the joint. Once you enter the joint, you can know which direction to go to enter into the shoulder joint. Once this is done, you can take out the needle and put a small nick with the help of a number 11 knife, and you can use the trocar to enter the joint. Again, you can direct it towards the coracoid, and you can get that giving way feel when you enter the joint. Once you get that feeling, you can be rest assured that you are inside the shoulder joint. So the second portal is the anterior portal, which is medial to the coracoid, which is done under visualization. So by viewing through the posterior portal, you can use your thumb to press on the anterior aspect medial to the coracoid, and you can see the movement in the rotator interval. And in that point, you can insert a needle to enter the shoulder joint. Once the needle enters the shoulder joint, you can see the direction which the needle is going, and you can take out the needle and use a number 11 knife to open the anterior portal directed along the direction of the needle which was put earlier. So the third most important portal is the lateral portal, which is made slightly lateral to the anterior anterolateral border of the acromion. So that is for doing the subacromial work and for doing rotator cuff repairs. So when you are putting this portal, make sure that it is little more lateral so that you can enter the subacromial space with your instrument, so that the instrument is parallel to the under surface of the acromion. That will help in doing your subacromial decompression and acromioplasty very easily. Another portal slightly posterior to this lateral portal can be put for doing your rotator cuff repair. So you can manage the sutures with these two portals. Another important portal is the Wilmington portal, which is lateral to the angle of acromion, which can be used for visualization of rotator cuff tears and for repair, and it gives better visualization compared to the posterior portal in some cases, especially if the tear is more anterior. One more portal which sometimes we use is the Neviaser portal, which is between the acromion and the clavicle, and it comes from the upper part into the joint. So that helps us in doing a slap repair, for managing sutures and even for putting anchors when you are doing a slap repair. So these are the major portals which we require in shoulder arthroscopy. The most of the shoulder work can be done with the help of just 3 or 4 portals: the primary viewing portal in the posterior part, the anterior portal, and the 2 lateral portals. The remaining are to be done only as and when required. So 90% of the job can be done with just the 4 portals which I mentioned earlier: the posterior, the anterior, and the 2 lateral portals. But when you are doing a Bungart's repair, you will require 2 portals in the anterior aspect, one antero-superior and one antero-inferior portal, both coming into the shoulder joint through the rotator interval for managing sutures and putting the anchors. So with these few portals, you can manage almost everything in the shoulder. Thank you.